It's coronavirus day 8 900, and we are reporting 1,500 plus dangerous cases again. Although the number is actually much higher than that. Kieran Moore is just withholding information from us. 97 deaths are reported this week. So last week we reported 99, but this is just plus 8 more. So compared to the last week's number. Of course, more cases started because of increase because of BA4 and BA5. Oh, this is just no. Unfortunately, that nothing's improving. While previous weeks cases that dropped, but apparently it's not. And speaking of Kieran Moore, he decided to make this rule where individuals who test positive for coronavirus no longer need to isolate for 5 days as long as their fever has cleared up and symptoms have improved for at least 24 hours. Although the fall season's coming and influenza is also coming back, he says, if you are sick but if your symptoms sort of get better, you can go back to school, you can go back to work. So previously he said stay at home when you're sick. You should not go back to school or work environment until your symptoms are resolving and improving for at least 24 hours. But there was a 5-day isolation rule that was originally put in place. So the original wait was 10 days until you could go back to school or work. And then they reduced it to 5 days. And 5 days, that was safe enough. And schools were also making that mandatory. So if a student or staff member was sick, they needed to stay home from school and learn from home or work from home. But Kieran Moore is just, this is just another move risking people's lives at risk. And he also says this advice applies to the general public, but mostly towards high-risk facilities like long-term care and acute care facilities, where over there, that's where the 10-day isolation will be maintained, while everyone else, and school is starting literally next week, and Kieran Moore is making a grave mistake. This will affect students and staff going back to school. And not to forget that not just influenza, but wave 8 of coronavirus and a new variant is likely going to show up. People are going to be indoors more, and this will affect more people. And Kieran Moore is just one of those people saying, Oh, vaccination and hand sanitization, that should be good enough, right? Wrong. He doesn't even consider about wastewater levels or hospitalizations or death numbers. And the fact that he also started hiding information from us since early this year also showed how unreliable he is. And he literally said that individuals can return to work or school even when still testing positive for coronavirus on rapid antigen tests, although they should wear a mask for 10 days from symptom onset, which just puts literally everyone in the school at risk. So there could be like some people who only got like one or two vaccine shots, or maybe didn't get their third, so a booster shot as they call it. So this is just putting people's lives at risk, and Kieran Moore doesn't care. Although he plays around with stay up to date with vaccinations, that has not been reliable. And other things also should have been focused on as well, not just vaccination. And many health experts have also been firing back. Not to forget that Kieran Moore lifted many mandates and rules that actually did work and helped lower cases. Even though the health experts reminding people to continue to still wear a mask. Health expert Ryan Imgrund saying, reminding again that Kieran Moore does not care about that Kieran Moore encourages people who are still affected with coronavirus to work in schools where they could infect people in schools, staff or student. And even parents were also worried about this. And this will be the wrong way to start this school year, 2022-2023 school year. And also he thinks that hand sanitizing will also fix the problem, but that's not the case. A whole lot has to be done. And Kieran Moore deserves to be fired for his neglect toward actual care for people in Ontario. And this is just going to make life in Ontario just worse. No wonder why Quebec is doing much better than us. Hospitalizations. Hospitalizations is at 1,245, so slight drop. Not too bad. Also, ICU patients have also dropped 146 from last week to 135. No, not a ventilator. It was 62 on a ventilator. Now it's 47, so that's sort of an improvement, but that number needs to be much lower. No, not bad, but it's concerning about how this school year will begin. And also with post-secondary college and universities, not all universities are still recommending masking or vaccination or booster shots. Western University is over in London, but other college and universities they are not. Only for on-campus residents or students, but on campus they are not, as we hear. So this is a big problem. So stay safe, Ontario. That's the news for this week. Stay safe. Continue to follow current safety rules and regulations. Be aware of any change of any rules and sports. Don't listen to Kieran Moore ever. Doug Ford, Sylvia Jones, Ontario Science Advisory Table, and Stephen Leslie are the bad decision on affect Ontario. And again, let's see if HEPA ventilators actually get installed this school year, because highly chances there won't be. But you know how Stephen Leslie works, no? No? He doesn't care at all.